Dr. Sinha, wonderful being with you today. You're really a world authority in head and neck cancers. You introduced a novel treatment for rehabilitation of swallowing using neuromuscular electrical stimulation. I certainly know if I'm seeking cancer care, I know who I'm going to be going to. But it isn't just about the work you do with the patients, it's also about the partnership you forge with the patients, isn't it?
That's right, Rod. First of all, really thank you from bottom of my heart to select me for one of the doctors in your series. So we always take care of patients, not just the patient. It's more family centric. Family centric because so many complexity of cancer is so high, and so much emotion goes behind it. So we always thought that early on, when we established our program, that our program should be built upon not just patient, also the family, the caregivers. And that's why we like to engage all the family members, because the psychosocial need for the patient at that time is so high that, that they really need support.
Uttam, we know that lifestyle has a major impact on our health, and certainly for those recovering from cancer. What lifestyle recommendations do you give your patients?
So if you look at the definition by World Health Organization, definition of health, it's a state of physical, mental, social, and spiritual well-being, and not a mere absence of a disease process. So it's very important to pay attention to all four dimensions. This definition is very, very powerful because they are all four dimensions are complementary to each other. For example, if you have strong mental health, that brings discipline. Like you every day you do exercise. First thing in the morning you do exercise, which I know. Cancer cells like acidic environment. So if you do exercise and a lot of oxygen goes inside the tissue in the body, then they don't thrive. So that's why I promote physical exercise. Similarly, mental exercise, people should do that. Mental exercise, which could be one form of other like meditation or respiratory training or Tai Chi or Qigong or some sort of exercise that will also bring discipline. And if the discipline is there, automatically you can control your mind. So maybe you can have a craving for sugar, but you can control not to add sugar to your drink. That's why mental health is important. That affects the physical health. So they are all interrelated.
Interesting. I do exercise in the morning, and I do that because I know myself. At the end of the day, working here and getting home, 6, 7 at night, I know I talk myself out of it. Whereas in the morning, I just force it to happen, and I don't have an opportunity to rationalize not doing it. So,
and see, this is the component of mental health, because you have that strong mental health, you have that discipline. No matter what, you are going to do it.
We had a common patient that you and I are very familiar with, and all the things that you've talked about are really, what you practice. And because I know, it's a pretty big cancer, head and neck cancer for this individual, and I happened to accompany them into the visit with you. But what really struck me was you spent probably about 5 minutes on the actual cancer, and the diagnosis, and spent the balance of it on lifestyle and the things you've just talked about. And it was remarkable to me, but it made so much sense to me. I'm sure you have that with a lot of patients, and so what inspires you when patients come to you and in terms of what you do each day, and makes you really care about their lifestyle and their changes there? Where does that come from?
I grew up in India, and growing up as a child, I used to see a lot of these patients on the street with large tumor from the head and neck area. And as a kid, I got inspired that one day I'll be a doctor and taking care of this patient. So I'm the only doctor from my family. Everybody else are engineers or other profession. So I went to med school, and then I wanted to do research in head and neck, mostly oncology. So I moved to USC and did research. in head and neck area, and that, I mean, it stayed with me. That exciting part that we have to take care of these patients, and we have to train our future generation. Yes.
It's been wonderful visiting with you today, Dr. Sinha. I look forward to our work together in the future, but thank you for taking the time.
Absolutely. I'm so honored to be with you. Thank you.